Okay, we're going to take a minute to talk about how to read the Qest report. First of all, let's just go into the comprehensive analysis. That's the report we want to look at first. I'm going to make sure that it's in order by scaling it. Okay, I've got the highest or most inflamed here, and I've got the lowest reading here. I want to go to reports so you can see what the report will look like. You can actually just go in here and hit preview. Once you get the whole tank, hit preview, and it will show you what the report's going to look like when you print it out. Alright, let's talk about what's on the report. First of all, this is all the clinic information that you entered. You see the clinic name here, the email address here, the technician's name, address, phone number. This is all the information that you would find in the clinic information that we entered earlier on a previous video. Now this tells you the test that we're looking at. This happens to be her comprehensive analysis from August the 15th. It also has the client's name, their gender, their date of birth, as well as the amplification level. We know that the amplification level runs on each of the reports, but the only one we really pay attention to is the one from the comprehensive analysis, because once they receive frequencies, it changes the amplification level. Okay, now let's look here and look to see what was found in the comprehensive analysis. Now obviously she did not balance on her baseline, so she had to get an additional remedy for the eustachian tube, and this is the particular remedy that came up. If you look down at the bottom of your report, there's a little code here that you can see. Red is for stressed, yellow is for weakened. That means the body's no longer able to compensate for it. Basically, it's losing the battle. White is symptomatic or causal chain. Green boxes are balancing items, in other words, the balancing frequencies. And if they're blue items, they're from the retest from a previous comprehensive. That would be items that didn't clear from a previous test. Now, in this case, the first thing we're going to look at is the fact that there is an imbalance here. Now, this, of course, was from the causal chain issues, and it came from the balancing of the baseline. This tells you that she's got a yellow here. That means it's weakening the body. And it says vaccination disturbance. It's a 33, which 50 is normal. The further away from 50, the worse it is. Of course, your yellow readings are more detrimental than the red. In this case, this is a yellow reading. It's weakening the body. The body's not able to compensate for it. And then your remedy is here. This is the actual balancing frequency. The next thing we see here is a 36, weakening the body, and then this is the balancing frequency. So basically, by looking at the frequency that it takes to balance, you have an idea of what this individual is dealing with. We can tell here, in this particular case, it's circulation. Now we can go further down. We see fungal signatures. It's 38, and this is the actual balancing frequency. This is what's going to bring this fungal signature into balance. Also notice the dilution is printed over here because I selected it. Now if you're doing your client reports, you're probably not going to want to have the dilution on there. This tells you if it's more physical or energetic, which we talked about in the dilution guideline chart in an earlier video. Let's go down and let's look at some stressed readings now. If you look here, it tells us this is an inflammatory issue. It's a 58, so it's not that far from normal. And it's being created from an inflammation miasm, something that was genetically inherited that causes inflammation in the body. So this is your balancing frequency. Okay. Here we have this reading is a 60. And the balancing frequency is for x-rays. So that tells you that looks like it's energetic, so it's somewhere in the past that there's some harmful energies that's affecting this individual. and so this frequency will balance that area out. Now let's go in and take a look at how to read an allergy scan or a sensitivity scan, because a lot of people get confused when they look at these. So this is the allergy sensitivity test. I'm going to scale it because I want to put the worst up top. You can do this either way. You can scale it and have your worst offenders up top, or you can do a filter test and it'll put the different categories together, like it puts all the dairy, all the spices, all the beverages. However, when I look at this, I like to look at it in order. I want to know what's the worst offending agent, or the one they're having the largest reaction to, so I always scale it. Alright, so I want to go in and I want to look at this report. So I'm going to go to the whole tank here, and I'm going to do a preview. Alright. Now, what I want you to notice is, of course, this is the food sensitivity test, and dairy is the category. That does not mean that she's sensitive to all dairy. The remedy or the balancing frequency is cottage cheese, so that means she's having an issue with cottage cheese. Legumes, it's not all legumes, it's soybean. Vegetables, she's not sensitive to all vegetables, to mushrooms. So you get the idea. The balancing frequency is actually the offender. And the reason for that is that if we give this in homeopathic form, it helps to desensitize the individual to the actual sensitivity. So your remedy is your actual sensitivity. It's kind of the opposite of what you would think. A lot of people get confused when looking at this. And that's how you read the Qest reports.